All right, everyone, welcome back to the Queer CME podcast. I'm very excited to have Kenya on. King, why don't you go ahead and introduce yourself?
Ooh, I'm never sure how to do that. My name is King or King, yeah, and my pronouns are they, them, or my name. And yeah, I'm a Jamaican who has grown up in Toronto, and I've spent 12 and a half years living in Cape Town. I now live virtually, and yeah, I've given birth to three humans, and I have lost one. And yeah, I like reading. I love teaching. I love imagining new futures for especially for Black and queer and trans people. And I don't know if I mentioned how much I love the game. And I think that if I could be addicted to, well, I'm addicted to perhaps many things, but I guess my health addiction is learning. And I think that even that is depending on who you ask. My partner would say, hey, wish that I would stop finding out for courses. So yeah, that's a little bit about me.
Yeah. And I would love if you would share more about how, ooh, wow. I almost started with a really, really big question. And then I was like, wait, let's
Mm.
focus for a second. I would love you to share a little bit more with our listeners just about how your work relates to the space of trans healthcare. I've taken one of your trainings before,
Mm.
and just so people can be really centered when they're listening for how you interconnect with what they do as prescribers for gender care.
I can like kind of go back a little bit. So, my work initially started off, I've had very many chapters of my very long life. I'm old. I was previously a personal trainer, and then I moved my work into specifically moving away from training athletes and into working with trans people who have a complicated relationship with their bodies. And I was also a body worker as well. So I work with people who have had top surgery or people who have been binding and helping them to open up their chest so that they can breathe a little bit better and also to be able to like connect with their body as well so that they can know when they are in pain, know when, they can actually be seeking out, more medical support and also on how to advocate for themselves while doing it because a lot of times it's very difficult to admit to a healthcare provider that your ribs are feeling crushed, and why that is. And because a lot of times healthcare providers are like their response is simply to stop doing this thing, not realizing that this is what it means to be gender affirming. Right. It's not as simple as that. Yeah, so anyways, I was doing that, and I really enjoyed that because I really love I'm very interested in movement, and I was glad when I kinda moved out of that transition into reproductive health in say around 2018, that there were enough people who were doing that type of work. There were a lot of healthcare providers, sorry, like fitness providers who were more talking about, again, health at every size and meeting people where they're at when they have had experienced trauma in gym culture, toxic gym culture, or else in families where there's a lot of negative conversation comments around people's bodies. So there's that. And when I moved into reproductive health, the timing was, I guess, I don't know if it's a so-called thing of being perfect, but it was my own experiences and challenges with trying to find a healthcare provider trying to like get, a gynecologist who would not somehow harm me. And I had that experience, which I don't know if there's I'm gonna go into, but it was realizing that there were so many other people who were experiencing the same thing and what it meant that people were just not willing and caring for, their bits, by whatever name. And I felt extremely frustrated. I wouldn't even say I was frustrated, but also I was enraged. I think that it was born from a place of actual anger. And that's how I started to work as being the queer birth worker. So I don't know if I even answered your question.
I
Yeah.
think you I think you answered the question phenomenally. I came to your work originally through your queer birth worker content, and I think you mentioned, like, you had this traumatic experience, and you mentioned, "Do we wanna hear about that?" I'm happy to hold space if sharing that would feel, appropriate for you. I also tend to encourage when I'm training other providers for them not to ask for our trauma porn, but to really frame the conversation around, like, what do you wish providers knew and would take with them from your negative experiences to protect other people in the future? So to kind of look more towards the positive way to move forward together as opposed to like you having to perform your trauma for people. And I'm really open to the space taking whatever shape you would like it to take.
I'm good to actually share it, and thank you for that. And I think that it's also necessary for people to know that that does happen quite frequently. And yeah, because I've been in spaces where people have centered that they are good people and they would never hurt anybody. And I'm like, okay, but do you see that it just happened? I don't think that it's an intentional, trying to harm, but it just happens. And if you had some sort of awareness of how easy it can happen, yeah, maybe that will help you to be a little bit more mindful and be more proactive in ensuring that it doesn't happen. So my experience was that I was trying to find a healthcare provider, oh, sorry, the gynecologist every year. I always schedule my annual examination. Previously, I did. I've taken care of that, so it's no longer a need. But that I would ask my friends for a recommendation. So, anyways, by this point, after a few years of failed attempts. Did not go well. By that time, I thought that I had an understanding of questions that I needed to ask while making an appointment, things to look for. And I contacted this doctor, and the usual thing that would happen is that I would call, and the receptionist would ask to speak to the person who their appointment's for, and I would say that it's from me, and then they would repeat the question again. No, I need to speak to, you know, your wife or whatever it is. And it's funny because I really don't even think that my voice is that deep. But yeah, so getting past that, making the appointment, got there, and I actually asked the person, the receptionist, whether or not the provider is my mistake, is LGBT friendly. And of course they are. And I got there, and the receptionist, I thought was like, again, assumptions. I don't think I was wrong, was a butch. I think that they would probably just, um, and so I'm like, okay, good, good. This is looking good. And I checked in, sat down, and the doctor came out and called my name. And they looked really visibly, they did not actually even acknowledge me when I stood up and I said, yes, yes. They looked around me. Then they looked really uncomfortable and had me follow them into the room, and they left the door open. And yeah, left the examination room door open, and we were seated at a desk first. They asked some questions. They looked really puzzled, but I already was prepared. So I went through, my history, that I gave birth, that I need an annual checkup, that this is what I do, da, 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 and what type of sex I have. And they were just so uncomfortable. So then we went around the corner for the actual examination, and I asked for the smaller speculum, and they're like, "Okay, but why?" And it almost seemed like a quiz. But if you gave birth and had a vagina, then why would you want? I'm like, because I know that it exists, and that is what will make me feel more comfortable. So then they continued asking me inappropriate questions until they actually put the speculum in the wrong hole. And so yeah, that was actually, I thought that that was pretty bad, but it actually continued to get worse. But anyways, and I share all that to say that people's curiosity, their discomfort and their curiosity, that it can cause so much harm. And also, when is the time to be asking people questions? I think that I
I'm
don't
just
think that, yeah.
I'm just still stuck on they put the speculum in the wrong part of your body like that. I'm also stuck on the door being open part of like you sharing vulnerable, intimate information about your life, your body with an open door, like the whole experience, obviously, there's like multiple issues along the pathway. Those two are like definitely in the appalling category. Yeah. Wow. I am so sorry.
Yeah, so you're right. There's around like privacy, there's around there's issues around like privacy, issues around centering. I'm not too sure if she thought I was going to attack her. But it's funny because it goes back to what's happening right now, the conversations around trans women being in the bathrooms, as if people think that trans women are going to just jump out and blah, that trans women are boogeymen and who is actually the people who are dangerous. I've had more dangerous encounters in the bathroom by cis women if I try to go there because they're saying, you know what I mean, that I had, I don't know, in many other places. So, yeah. So there was that. There was asking. I think that regardless of anyone's gender identity, you don't ask a lot of these kind of intrusive questions, period. I don't think they should be asking intrusive questions at all, but also understanding the vulnerability of when people are on this examination table, what type of questions that you're asking and what you can wait until people are fully clothed and sitting in front of you. And there's a gazillion ways that that could have be handled with more sensitivity, with more care, and with yeah, you know what I mean? Like, I think that even I'm hesitant to even use the word care provider because I think that a lot of providers are not actually offering care. They're not showing up and being caring people, So, anyways, I think that there was a second part to your question as to what it is I would like care providers to know. I think that I would like care providers to know that and not even care providers, I'm gonna say providers, healthcare providers, to know that a lot of times people are trans or non-binary, and there's something about you that has indicated that you're probably not a safe person to disclose that information to. I've had a lot of providers say that I don't work with trans people, and I feel like it's really dismissive. And the way that it's said is if it's like it's offhanded. I don't work with those people. As if and I feel like it's if those people as if those people are not real people. I feel like the way that it's said, it's gross the way that it's said. Those people. I don't know who those people are. And also, yes, you do. Yes, you do.
Absolutely. Yeah. I think there's so many learning pearls in the story you shared. Thank you so much for sharing it with us. And I think one of the first ones is like, and this has shown up in research and literature as well. I can't remember the article off the top of my head right now, but I quote a piece from it in one of my presentations, but that sometimes the actual provider will have skills in working with trans and gender diverse people, but if the rest of the team isn't also trained, the trans person might not ever get to the provider because if like when you called and people are like, no, I need to talk to like, right. If like the staff is making assumptions, if the staff is asking inappropriate questions, if the staff isn't welcoming, the paper I quote actually talks about a patient being dead named in the waiting room when they're called back and they just like never go to their appointment. And so I think one, like having the entire staff trained to be affirming and inclusive. I feel like one of the questions I get back about this when I am in the South training and educating too, which is actually where I'm originally from, the South of the United States, is it's like, "Oh, but people get really upset when we ask about, like, what they wanna be called or pronouns and things like that." And I always like to remind people that my family of origin, my grandfather's name is Arthur Chipman Beale, my dad's name is Arthur Chipman Beale, and my brother's name is Arthur Chipman Beale, right? And one's senior, one's junior, and one's the third. And my grandfather went by Art, my dad goes by Chip, and my brother goes by Chipper, so not a single one of them goes by their legal first name. Um, right, and this goes back to the basic principle that, like, the more inclusive we are, the more it benefits actually the people with the most privilege anyways, and so there's ways to center the importance of this no matter where we are and no matter the reception of the people around us. Um, and so I think there's the importance of having everyone trained. And then I feel like one of the most important things I hear in your story, like sitting and listening as a provider, is like, it is so essential for me to say when I am not, like, when I don't have what my patient needs. Right. And like, I think the example I use of this a lot of times is like, I can't do joint injections. I'm a family medicine trained physician. Joint injections were part of what I had to train on and do to graduate residency, but we really did them under ultrasound guidance at my residency program. And so when I was out doing work in public, they didn't have an ultrasound. And I was like, I'm not comfortable that I can get that needle into that joint without an ultrasound. Like that's like, and so I had a colleague who felt very confident and comfortable doing joint injections. He did not want to do any long-term birth control implants. Like, so right,
Mhm.
I got all of his patients who needed long-term birth control implants, and he got all my patients who needed joint injections. But I didn't say I can't take care of you or I can't take care of these people. I said, "Oh, if you're wanting to consider a joint injection, I would actually have you see my colleague because he has like better skills and will be better able to like support your needs." Right? And I think there's an importance of like there is a way we can say like, "I don't have the skills that you need, but I'm gonna help you find someone who does." That's a very different response than, "I don't take care of trans people." Right? Because there's a lot of things I only do trans healthcare now. So there I can't answer questions about your diabetes medication. Like, my information about that is like 15 years out of date, right? Although I'm restarting my boards right now, so I'm getting caught up. But, it's just one of we do want everyone to be like accepting, affirming, safe. I don't necessarily need every single healthcare worker to have the medical knowledge needed to serve my needs, but I do need my healthcare worker to be able to say they don't have that knowledge and they can get me somewhere for that care. And I
Mhm.
feel like that, again, that's a very different experience than like me feeling unsure of my skill set, asking you prying questions, leaving the door open because I feel nervous. Like, right? But there's a willingness to say I don't know something that I find is very hard for a lot of healthcare providers.
Yes, yes, and I agree with you. I think that it is really important for people, and I mean across the board, if this is not your skill set, then to have referrals that you have vetted yourself that you can, you can use. However, there's certain things that I don't require that it requires any, I don't think it requires any special skill set. What it does require is you to not be an asshole. Right? So if I'm very clear that what I'm there for is a pap smear, do you know how to do it? Can you like, you know what I mean? And can you just be kind? Right? Can you do the pap smear? Can you ask whatever questions that are specifically related to what is happening right now and not be weird? Really, really just not be weird.
Absolutely. I 100% agree. Like doing a pelvic exam and like
Mhm.
cervical cancer screening is a skill that most gynecologists have. Right. And yeah, there needs to be like, again, that baseline improvement in training and education. And that like allows clinicians to meet patients where they're at more appropriately. This is a really great question. I was just like having so many things go through my mind because there are a
Mhm.
few things, like, and I don't know your case specifically, right? But like there are a few things about if someone's on testosterone, like pre-treatment prior to pelvic exam with genitally placed estrogen can like improve collection of cervical cancer screening samples and things like that. So there are a few kind of specialized pieces of information that like seeing someone who does work with trans patients more often will like have an overall better care outcome. And you're totally right. Like people just like the biggest thing is like be caring and don't be an asshole. Right. Because like exactly what you said is like, I never asked history questions while my patients were naked. Like, right? Like at the point of like the encounter when my patients were in a gown and
Mhm.
sitting on an exam table, that was the time that we were only doing the exams,
Mhm.
right? We weren't having conversations. We weren't
Right.
asking questions. Even if like something on exam made me think about questions I needed to ask, right? That is
Mhm.
something, again, you're exactly correct. We wait until our clothes are on. And I think this is coming up more and more in like cis care spaces as well. I've seen it more from providers because like clinicians are trained that cervixes aren't innervated, so there's no pain. So you don't need to provide anesthesia for cervical biopsies or for placement of IUDs. And there are more and more clinicians saying like, this is absolutely inappropriate, right? That like we should be providing anesthesia for this, that it does cause pain and discomfort, and that we can improve that. And that is like, it's the same principle. Like if we care enough, if we care enough to slow down
Mhm.
and to like ask what our patient needs, like exactly what you're saying, right? We are better care providers. Yeah. But 100%, like I agree with so many, like there's so many learning points in what you said in the context of like the team training, the like, I think you mentioned too the appropriateness of curiosity. I feel like
Mhm.
approaching things with curiosity was a technique I was taught in medical school as like a way to be affirming and inclusive. And I'm like, I hate that one so much because I feel like to me, approaching it with curiosity means I'm asking you to educate me about like something that I need to educate myself about.
And I was gonna say that I think that curiosity is a beautiful thing. We teach children, have more curiosity. I think that we can have more curiosity. And I think that the curiosity for providers can be a great starting point for going and seeking further education. Going, oh shit, I didn't know this. Or this made me uncomfortable. What made it uncomfortable for me? Gee, what do I need to know? There's somebody who came that didn't look the way. So that starts your own curiosity and what do you do with it? What I had, which I didn't go into, is to stop returning my messages, send me a prescription by text message, and then not answering as to what is this actually for? Like, what did you find in to have a doctor stonewall me, basically, right? So, but your curiosity can lead you to go and find out more, right? Or be very clear that, and I think that maybe that might be helpful is you know how people do this like sharing like little rainbows and these little whatever it is, these virtual cues. Also do a virtual cue. I'm a trash person. I will never be able to. What I deal with is specifically to cishet woman, right? Let us know, right? And whatever that makes you look like, when I see people's in birth work and they talk about is womb this and woman this and and woman with X's and woman with Y's and whatever it is that they're doing, that tells me I'm not referring. I'm like, you have your people. Beautiful. And when you talk about your woman retreat and you're spelling it with a womb, that tells me that trans women are not going to be safe more likely. There, I'm not going to. You've given me everything I need to know, right? I think that it is important for others in this work to also do the same thing. Do your virtual cues that you don't give a fuck. And I don't think that that's a bad thing, you know what I mean? And that tells me that you're not going to, you're not curious. And yeah, that's fine. That's good. That's good information for me.
You
Yeah,
mentioned
yeah.
previously that, like,
Um,
yes, if you don't have the information or skills needed to serve a patient, that you do want to have a referral list that you have vetted. And like, I 100%, I always remind clinicians that if they have like student learners or if they have social work support, right, that vetting can happen. Like other team members can help them vet people
mhm,
and like build a list. And also their local LGBTQ community nonprofits and grassroots organizations might already have resource lists as well that you can use as a good starting point for vetting
mhm,
people. And I think the other stuff I always encourage clinicians is like when a patient wants to go, because there are some gender affirming like a lot, especially like top surgeons that like I'm just never going to talk to all of them in the United States, particularly because I have a telehealth practice and work in 10 states. Like, and
mhm,
so many surgeons do top surgery. And even some of the bottom surgeons I haven't talked to personally. And so when people are like, I'm interested in seeing this surgeon, I'm like, great, I don't know them personally. I can't like specifically tell you anything about their practice or their bedside manner. So I want to be like really transparent that if you want to see someone I know more about, like I'm happy to make recommendations. If you want to see this person, we have some resources for like how you can research them and vet them before you go. Yeah. And it's so funny. I've been listening to Love and Effective World, the podcast. Have you seen the guest list for that podcast? It's phenomenal. It's like so many
Yeah.
people who shape my work. And I feel like the whole podcast has really been about like direct and transparent, like and kind and ethical communication. That is
Mhm.
how we build relationship and movements. And like
Mhm.
healthcare is, I mean, you have been talking about this point so richly. The care part, the care is a relationship,
Mhm.
right? And we don't want it to be like an abusive relationship. We don't want it to be a toxic relationship. We want it to be this caring relationship, and caring relationships are rooted in this like ethical and transparent communication. We have like a list of clinicians we have specifically vetted, like our team has. And I just let people know if they're seeing someone else, right? Like what I do and don't know about them and where they might be able to get more information. Yeah. Yeah. Sorry. I'm like lost in a
No, no, and I agree with you, and also, I'm gonna feel like I'm gonna keep saying doing the "and," so yes, I agree with you 100%, and one of the things that I believe that if you are and I don't really feel like it's like a check mark, a checkbox or a checklist or anything like that, but if you are doing, offering, believing, desiring to be gender affirming provider, I think that I'm confused as to how one can be and then not recognizing that there has to be a through line that yes, that means the receptionist needs to be. It means that you need to look at your space. Are the bathrooms going to be, because it's not just you, right? You're not, it's not like this person is not going to be going through, as you mentioned, a whole bunch of other like obstacles in order to get and reach to you. What you want to do is to clear the way. That means that downstairs, that the staff, whoever comes and does the welcoming or whatever it is, that they're also this thing of hello, sir, good morning, sir. You're gonna know whether or not there's going to be an elevator or stairs or anything else that might make it easier or an obstacle, right? Because some of your patients are going to need these things. The receptionists, are the chairs going to be, what is the space like, right? Because gender affirming means that you're looking at all the intersections of things that people need. And all of those things must be put in place. So that was one thing I was going to say. And then the other thing I was going to say was around this vetting that a provider will do is they'll do this only when they care, right? So if you don't care about someone like my identities, you're not thinking about having a list of providers who might be a better fit than you. You don't give two fucks about me, right? What you're going to do is make me uncomfortable when I come. You're probably going to, because I did pay out of pocket. You're going to make people come, or you're going to just do something to make it like, a completely shitty experience so that they never come. You're not going to give them the full, you're not going to ask them all the questions that you should ask them. You don't care, right? You don't care how this experience is going to go. You're not going to think that I have other people. You might, like show your disdain for my identity, for me. So yeah, the vetting is not happening. All these other things that we're thinking that, there's not part of some oath of to do no harm, right? It's almost goes back into Trumpism. If you don't think that somebody is a real person, right? They don't actually intrinsically have value, just their life. You're not going to do these things. You're not going to think about it.
yeah. I think this issue has become so much more visible because of the current administration. And I think it's really important because I think one, a lot of our listeners are people who have been doing gender affirming care for years and who probably have many of these things already in place. But I think it's really important for people to like hear that this disdain still happens, right? That it, even though it is 2025, one of my very close friends texted me from the emergency department the other day where she was because she was having issues with her recently surgically constructed vagina. And the ER doctor kept misgendering her. And she was like, and she has like long pink hair and, dresses pretty femme. And like, she was like, I understand like not everyone who has a vagina uses she, her pronouns, but like, I'm here for my new vagina. Can you not get my
Mhm.
pronouns correct, sir? And I think, you know, these things are continuing to happen. People are continuing to experience this disdain. And what King is saying about the more, systemically undervalued identities someone carries, the more disdain they're going to run into and the more issues they're going to run into accessing care because there's just more pieces that haven't been put in place, right? As far as accessibility, like how do I access the space and who fits in the space? I have friends who had advertised weight loss as one of their primary parts of their practice, and they did not have bariatric furniture in their waiting room. They had chairs with arms on them. And so I think, yeah, the holistic picture of what you're talking about is so essential. And like, we're not there, even though we have like made some progress. And I think I would love, we've talked a lot about like what happened to you in things we want clinicians to know. I would love you to share some of the trainings you have up and available, though, for clinicians and some of the work you're doing now, just because I want our listeners to have an opportunity to find you moving forward because I feel like you have so many valuable things to say. And I think a lot of King's work has shaped a lot of how I think about intersectionality and like re-indigenization and anti-racism in these spaces. So I'd love other people to be able to access your work as well.
Yeah, thanks for asking that. I think yeah, you mentioned that a lot of the people who already listen to this podcast that where they're at, and I think that's great. And I think that there are a lot of clinicians, a lot of providers who don't really see the gap, what they know and don't know. So my work really starts with like where are you at? Like what are the things that you actually think? What are the things that because we all have, I mean, we all have biases, we all have prejudices. There's no way that we can exist in this world without, I mean, we all went to school here in whatever the West is. We watch the same shows, we listen to the music, and so we're going to have some bit of, I'm Jamaican, so there's going to be homophobia, there's transphobia, there's colorism, there's all these type of things. So yeah, so my work kind of like complements whatever medical training that people have already have gone through, but it addresses more around emotional, relational, and systemic dimensions of healing that medical spaces often overlook. And a lot of times, so there's that, but it's also like looking at where you're at, looking at whatever that space is, that gap between there and there, here and there. And it's without, you know what I mean? Like without bringing any shame to it. Like, oh shit, I didn't actually know that I'm thinking that. Right now, I think that it is even more so important because as you're talking about the person who, went into hospital and was misgendered, that a lot of healthcare providers perhaps were trying to, like struggling to like get language, try to, appear to be correct, right? And now they're like, "Whew, that was too much work anyways. I don't even have to. Now I could just misgender people. Fuck them, right? Like they don't have to do it, right? So my work really is for people who are really intentional, right? Because at this point, you don't have to. Trump has just told us that you don't have to even try. So yeah, it goes beyond, language, but really looking at like frameworks and to unlearn bias and to build affirming and trauma-informed relationships. Because I do think that it really does come down to relationships, as you were saying, it's relational, right? And it is, I mean, if you're I don't know if many people who are providers are listening to podcasts like, was it Love in a Fucked Up World, right?
Yeah.
Right?
Yeah.
Right? So they're not actually thinking about how to be in good relation, how to build like this community care, because that's really what it comes down to, right? Like recognizing that you are invited in to the care of this person who has full bodily autonomy. And again, I think a lot about around like dignity, right? And when you know that you're invited in, you hold that with reverence. And you know what I mean? Like you're like, wow, like that is an honor that you invited me in to care for you and your whole kind of body. And that's I'm a part of. Right? And I also want to, because you respected me to be here, the people who I also wanna make referrals to, I want them to be also people who you'll be like, you know what I mean? Like, you're not gonna bring the shit person to the cookout, right? You wanna make sure that everybody is good, right?
Yeah.
And you wanna make sure that this person is good, right? Because that matters to you,
Yeah. Yeah.
right? Mhm.
I think sometimes in healthcare, we get, and this is not by any way an excuse, but I think the nuts and bolts of capitalism and healthcare systems like wear out clinicians, and we lose sight of that sacred trust that we've been given by our patients. And I think the framework of the language you're using is so important to keep incorporated in our ongoing education. Because when we lose sight of terms like dignity and sacred trust and vulnerability, we then do the things that happen to make your experience be so bad. And I think that's the essential. And I think for people who are listening, King does do, because you do custom workshops with organizations in the context of like meeting people where they're at and helping them move forward. And then you also do work directly with community members as well.
I do. Yeah. So the work that I do with providers, so I do have like set trainings that I just offer out openly. And then also I do work with like organizations themselves. So the set ones that I do, I have like two, I don't know, these flagships, whatever this language is. But one is like going through like a 3 month training for that goes across many types of reproductive loss. Grief and loss is something that I hold near and dear to me. So I do that sort of training because I think that a lot of times when people think of reproductive loss, they have a very limited understanding of what reproductive loss is. They usually think of it as being pregnancy related. But when we're talking about queer and trans people, we're not recognizing that it goes beyond that. It can be a loss of things around having a hysterectomy, but also it can be around menopause. What does that mean? What does it mean to have a loss of libido? What does it mean to have, you know what I mean, right? To lose community. And yeah, so there's a lot more loss that people don't seem to recognize. And I also do another 3 month one on Birth and Beyond the Binary. And it is really looking at all the different types of things around birth, reproductive health. And I enjoy teaching both of them because I love seeing when providers are like having their aha moments. And it really is going through and people going through and making like a concrete plan. So by the end of Breaking Me on the Binary, people really have like a whole policy as to how they can show up in their practice. And just seeing people like go through the steps for that, as well as grading, as you mentioned, like going through and knowing what the laws are in their city, their state, and then also knowing like what kind of advocacy work that they would like to be doing, and also vetting your resource list as well, right? So people are able to go through that. And then as far as working with individuals, I do have training that I do. I do some assignment training, some workshops that I really do for my fun is fucking with gender. So, where people get to explore gender when they may not have had an opportunity to do so. So they do that safely in a small contained container. And have oh my gosh, I was so very tickled that just finally got some funding to do Black trans reproductive, sorry, Black trans grief lounge. So that is on the first and the third Thursday of each month. And so that is, free for anyone to pop in and come to, but also, trying to create a container for that. So it feels like a little lounge. I don't smoke cigars, but something around that and be together and talk about different types of reproductive, not I keep saying reproductive loss, but just loss, and
Is that
which is really important right now.
remind me if
No,
that's an in-person space or a virtual space?
it's virtual. Yeah. Yeah. I tend to not be in person.
Right.
Yeah, I try to not be in person. And what else do I do that is, yeah, I've also been doing some preparation work for these times. So I had a workshop recently for parents on how it is that you can prepare your children for, yeah, for being in community, like how to build a little community that the children feel safe with the things that are happening. And about the things, when I'm talking vague, I'm not being vague, but it is around like ICE, deportation, supporting community members of, children who in their school, there's been book bans, there's LGBT curriculum that's been pulled out. So we're still trying to have communities that feel like communities, where children know where are safe places, children know that they are loved, that we're not making fun of, that we're not being, you know, um, we're not taking in the hate that this administration is trying to give us, wants us to have, that
Are
we're in
you gonna
resistance of it.
are
Mhm.
you gonna run that workshop again? Because I feel like I should have shared that one out with my patient.
Yes, I am. And also, so that one was like a short one, but I do have a long one. That was like a teaser. It was an hour and a half, but it really is because it does go into like preparing a go back. Because I think that at this point, these are the things that we really need to be thinking about.
Yeah.
And then I also have Earthseed, which is for families, and it is based off of Octavia Butler's. So we're using it as a study guide and then going in through that and thinking about for communities how we can ensure that communities are taken care of. Yeah, it is more from a communal, mutual support position. So yeah.
Yeah, I am excited to keep sharing out the work that you're doing. I think it is so incredibly valuable. And I think it's so important. I think, particularly like the community aspect, particularly working with younger trans folks, I think, especially because like during the Biden, you and I both know trans people have never had bodily autonomy or liberation in this country, especially if they are Black or brown, right? Or if they're fat or disabled. And I think particularly like there was this period of time where things felt like they were getting better, particularly if you were in like a protected state or a safe state. And so there was like the Obama administration and the first Trump and then Biden. And so I just run into some of my younger trans patients don't understand why they need to be in community with other trans people. And as like, where I'm like, we didn't have the internet growing up. So we had to be in community in real life with people. Otherwise we died. Right. That is what happens
Yeah.
to queer trans people. Um, and so I've been finding myself trying to explain, like find, the 5-second explanation I can give them when we're trying to do all this other stuff in our visit, right? Is I'm like, look, you need to be in community with other trans people because when you can't get testosterone from me anymore because the government's made it illegal, the people who are going to know are the other trans people. They're the people who are going to be able to get you your testosterone. But that's like that boils it down to that's not what it's about, right? Like you know that, I know that. And I just feel like I would love to send some of my family to that to your tree.
Mhm.
Please send them my way.
Yeah, yeah. And I think that is because I think that a lot of people have an idea of a vague idea around like white supremacy, right? But if you think of white supremacy of one of the, if you don't think about anything else, right? How it is meant to isolate you. It really, really is meant to isolate you to think that, the only person that you need to think about and the only person who can care about you is yourself, right? Individualism rather than going back to, I go back into whether you call it decolonization or indigenization, right?
Yeah. Yeah, I say
Right.
re-indigenization a lot. That I read a
Yeah.
really powerful article about it, but yeah.
That going back into like having a community, what that actually means, right? And it's funny because even with the Black trans brief group or the other, spaces that I've held for that, what that actually means, when people are actually in a space with other people who share some of their identities and being able to talk without having to explain and people wanting to like might have some resistance, cameras off, and not really wanting to share until people are like, oh, that person's actually saying this thing, right? Oh, that person's actually, and then you're seeing yourself in others, and you're like, oh, I'm not actually alone. And then they're asking for more. Is there going to be a Discord group? Are you going to make like a Signal group? Are you going to like, how can we still be in connection in relation? I have another group that's just sharing, what are those things called? COVID tests, because these things are going to be gone as well. I mean, I had something the other day, I thought it was COVID. There was no test to be found, right? Because COVID is gone, right? I mean, I'm seeing them like reappear, but COVID is gone now. What are the things like you're saying? Yes, it's going to be tea, but it's also going to be I'm on mental health things. Am I going to have access to my mental health drugs, right? Diabetes, so there's going to be a lot of things. Are we going to have access to food, right? So yeah, we need to be in community, but also we need to be in community for actually our mental health so that whether we are mad, whether we are lonely, whatever it is, we need people.
I think, yeah. And I think it has been interesting for me over the course of my career to see some of the individuals when we talk about like rooted in white supremacy. And just because the way generationally things have changed with the advent of the internet and the worsening of capitalism and wealth inequality, like community saved my life, right? Like I was in a situation with intimate partner violence and rape, and like I'm alive and here and who I am because I found community, right? So it wasn't like what you're saying, like all these things are important, like our medicines, our foods, like our all these things, and like what you're saying about the mental health, like the knowing there's nothing wrong with me. I'm okay. Like the way I am is just a normal way of being, right? And the connection that allows me to see that and see myself in someone else is like is so essential. So it's been interesting over the course of my career to try to remember also not to like put my experience on my young patients, right? To hold space for them to have a different experience. And I wouldn't be alive without trans and queer community. Yeah. Period. And
Yeah,
yeah,
period.
and I wouldn't be a doctor and I wouldn't be doing this work. So I just can't emphasize enough how important it is. And I think what King is saying and what Andrea Marie Brown and Miriam Cabo, that like some of the guests who are on Love and Effective World that we both love are saying, right, is that like without community, without relations, there's no resistance and there's no liberation. Yeah, we can't be liberated as individuals.
No.
Yeah.
No, no, no. And yeah, so thank you for sharing that. And yeah, and I want that for everybody. With my work, when I think about it, that it is from the full spectrum from conception to end of life. I want people to have a really dignified end of life. I see me when I close my eyes and I picture end of life for all of us, unless you really desire otherwise, for us to not be alone, we be held,
Mhm.
that we have people who will wash the body afterwards, and this person mattered, they existed, they mattered, we love them, and we cannot do that when we're alone. We just cannot.
Mm-mm.
So yeah, yeah.
Thank you so much for coming on the podcast and for sharing from your own lived experience and the work you do. I am so privileged to hear about it and to share it. And I look forward to being in connection in the future.
Thank you. Same. Thank you for having me.